Hello my dears, it's me again, Menopause Barbie, your menopause tailor, and I am on a mission to ensure that you get the menopause education you deserve. I strive to give you absolutely everything you need to successfully manage your menopause your way. And among the things that make successful menopause management possible is an understanding of the diseases you want to avoid. So I present all the diseases that have anything at all to do with menopause. I gave you huge units on the 3 diseases that are directly due to estrogen deficiency: heart attack, osteoporosis, and Alzheimer's. Then I gave you a unit on the 1 disease that is directly due to estrogen: endometrial uterine cancer. And since your total uterus actually consists of both your uterus and your cervix, now I'm teaching you all about cervical cancer and precancer. This is video number 350 on the treatment of cervical cancer and precancer. In my book, I cover all the diseases I've mentioned except cervical cancer and precancer. So you have to watch these videos for that. And the reason I don't cover cervical cancer and precancer in my menopause book is that cervical cancer is not common amongst menopausal women. Why not? Well, because of a few things. One of the reasons cervical cancer is not common amongst menopausal aged women is because it is caused by the human papilloma virus, or HPV. And exposure to that virus typically occurs early in your sex life. Since most women become sexually active in their teens or 20s, they get exposed to HPV in their teens or 20s. And after that exposure, you don't usually discover that you have HPV for about 2 decades. That's because it takes about 2 decades for the HPV virus to cause changes in the cells of your cervix that show up on a pap smear or an HPV test. So it's typical for a woman in her 40s to discover that she has HPV. So now you might ask, how can it be that cervical cancer is not a disease of menopausal aged women if HPV exposure is diagnosed in your 40s? Well, it's because HPV causes cervical dysplasia or precancer before it causes cervical cancer. The timeline looks like this. So here you see that even if you are exposed to HPV in your 20s, you won't have dysplasia until you're in your 30s or 40s. And if you treat the dysplasia, which constitutes pre-cancer for cervical cancer, you prevent ever getting cervical cancer. So this is the power of knowing the cause of a cancer. Cause is the most important factor for any disease. Knowing cause can negate the need for treatment altogether. Well, this video is on the treatment of cervical cancer and precancer. And what you'll see in this video is just how vastly different the treatments are for cervical cancer and cervical precancer. It all boils down to the fact that when you know the cause of a cancer and you can diagnose it as a precancer rather than as a cancer, you rarely have the need to treat the cancer at all. So you could say that it's a matter of more cause equals less treatment. So let's go through all the steps in the progression of events that can lead to cervical cancer and designate the treatments for each. And we'll make one of our famous charts as we go along. The first thing that happens is exposure to HPV. But you're not going to know that it's happened when it actually happens. So there's nothing to talk about in terms of treatment for mere exposure to HPV. 2 videos from now, I'll discuss the HPV vaccine, but for now, we're focusing on treatment, not prevention. So HPV exposure will be the first thing on our chart with no treatment designated for it. What you see here is a simple chart with 4 columns. The first column is for designating the category of the disease as precancer or cancer. Since HPV exposure is neither, I just inserted cause as the category. The second column is for the diagnosis. The third column is for the grade or stage of the diagnosis. And the fourth column is for the treatment for that grade or stage of the diagnosis. So exposure to HPV, which is the cause of both cervical cancer and cervical precancer, has no grade or stage and does not warrant treatment simply because at that point in time, you don't know you have it yet. The second step in the process happens about 10 or 20 years later, when you have either an abnormal pap smear or a positive HPV test. Both are screening tests for cervical cancer that is not yet cancer. It's pre-cancer. And the name for cervical precancer is cervical dysplasia. In video number 342, I taught you all about the transformation zone. The transformation zone is a line that separates the squamous skin cells that are exposed on the outside of your cervix that is in contact with your vagina from the glandular endometrial cells that line the inside of your uterus. And in that video, you learned that all cervical cancers and precancers begin at this transformation zone. So these cells right here in the transformation zone will be the ones that have become dysplastic. You also learned that there are different degrees of dysplasia. Mild dysplasia implies that the cells are minimally disorganized. Moderate dysplasia implies that the cells are halfway between normal and completely disorganized. Severe dysplasia implies that the cells are very disorganized. The question for today is, how do we treat these different degrees of dysplasia? And fortunately, when it comes to treatment, the degree of dysplasia doesn't matter. For purposes of treatment, all dysplasia is treated in the same manner. It's all still pre-cancer. And since it's localized to just the transformation zone, the treatment focuses on the transformation zone. When it comes to precancerous cells in your cervix, you want to remove or destroy them. Once you've done that, you've erased the possibility for them to continue changing into cancerous cells. So there are 3 categories of treatment for precancerous cervical dysplasia. 2 of them serve to destroy the dysplastic cells. 1 serves to remove the dysplastic cells. The 3 categories of treatment are freezing, burning, and excising. The first 2 destroy the dysplastic cells, and the last one removes the dysplastic cells. So now I'll tell you how each of these treatments is accomplished. First, freezing. Another word for freezing is cryotherapy. Cervical cryotherapy is a procedure in which your gynecologist presses a freezing cold probe against your cervix to freeze it. But the probe is shaped like a nipple, and the size of the nipple is such that it comes into contact with the transformation zone. So it includes a little bit of the endometrial tissue above the transformation zone and a little bit of the squamous tissue below the transformation zone. In video number 348 on the diagnosis of cervical cancer and precancer, you learned that in order to make a diagnosis of cervical cancer or precancer, your doctor looks at your cervix with a special microscope called a colposcope. And he or she uses acetic acid to make the abnormal cells stand out. Then he or she takes biopsies of those areas. So the colposcopy enables your doctor to see the extent of the dysplastic cells. And that tells him or her how large an area needs cryotherapy. So this is a smaller area of dysplasia than this. And the probe used for the two will differ. Here's a photo of the various cryotherapy probes. The arrow is pointing to the one with the most significant nipple shape. Okay, the second option for treatment is burning. And for this, we use a laser. So cervical laser is a procedure in which your gynecologist lasers the opening in your cervix to destroy the cells above and below your transformation zone and eradicate the dysplasia. Obviously, if you burn the abnormal cells, they are going to die and slough off, and they will no longer exist. This erases the possibility for them to turn into cancer cells. The third option for treating dysplasia is excision of the abnormal cells. Excision is the process of removing the tissue by cutting it out. And there are two common methods of excising the cells around your transformation zone. One is called cervical conization. Cervical conization is a surgical procedure in which your doctor removes a cone-shaped piece of tissue from your cervix that contains the transformation zone. This option does involve going to an operating room. Here are some photos depicting a conization. Here you see a picture of a uterus, cervix, fallopian tubes, and ovaries. Focus on the lowermost portion of the anatomical structure where the cervix meets the vagina and is labeled cervix. The first square to the right of the anatomical structure shows you the appearance of your cervix as your doctor looks at it during a pelvic exam. That's what it looks like before the cervical conization. And you can see a round circle drawn in black ink that depicts where the doctor will cut. So your doctor takes a scalpel and cuts into the cervix along that black circular line. But he or she angles the scalpel inward to excise a cone-shaped piece of cervical tissue. And the cone-shaped piece of tissue is what you see in the second box to the right of the anatomical structure. The next photo just shows you that the cervical conization removes the abnormal dysplastic cells. Obviously, once the cone-shaped area of your cervix is removed, the dysplastic cells are no longer there to turn into cancer cells. So cervical conization is a very effective way to treat cervical dysplasia and avoid cervical cancer. The other way to excise the dysplastic cells is by doing an office procedure called loop electrosurgical excision procedure, or LEEP, L-E-E-P. Loop electrosurgical excision procedure, or LEEP, is an office surgical procedure in which your doctor uses a wire loop that is electrified, and therefore hot, to scoop out a segment of the cervix containing the transformation zone. The instrument used for a LEEP procedure functions a lot like an ice cream scooper. You know how an ice cream scooper has that band of metal that sweeps under the ice cream? Well, that's the same thing a LEEP instrument does, with the difference being that the band of metal is exposed and scoops out a segment of your cervix. Here's a photo of the actual device. As you can see, the actual device looks like nothing more than a curved wire, but when it's hot, it cuts tissue. And if your doctor moves it in a scooping action over the opening in your cervix, it excises a core of tissue similar to the conization procedure you just saw. So it's kind of like the piece of metal that moves when you squeeze the handle of an ice cream scooper. So LEAP is another very effective way to treat cervical dysplasia and avoid cervical cancer. All 4 of these treatment options for cervical dysplasia are easy. 3 of them, cervical cryotherapy, cervical laser, and cervical LEAP, are office procedures. The cervical conization is not. It's an outpatient surgical procedure. All 4 result in a yucky discharge that may smell bad for a few days. And that's it. Afterward, you go on your merry way and just continue to get regular screenings with PAPs or HPV tests. None of this has any impact whatsoever on your ability to take birth control or HRT. Because treatment is so easy, most women never even think much about the fact that they had dysplasia. So here's our chart again with these treatment options designated for cervical dysplasia. But treatment for cervical cancer isn't so easy. In fact, compared to what I taught you about treatment for endometrial uterine cancer, treatment for cervical cancer is much more complicated. In video number 329 on treatment of endometrial uterine cancer and precancer, you learned that treatment of that cancer depends on the stage of the cancer. The higher the stage, the more aggressive and complicated the treatment. Well, the same thing is true for cervical cancer. But with cervical cancer, treatment for the earliest stage is much more intense than treatment for the earliest stage of endometrial uterine cancer. In fact, when you look at the difference between treatment of severe dysplasia compared to treatment of stage 1 cervical cancer, the jump is enormous. You know, people often refer to taking a big leap as a positive thing. You hear about leaps of faith and big leaps forward. Some say it's better to take a big leap than it is to take baby steps. And this may be true of many things pertaining to endeavors and success. But it does not apply to treatment for cervical cancer. In the case of cervical cancer, there is indeed a big leap between treatment for pre-cancerous dysplasia and treatment for the actual cancer. But it is not a big leap in the positive sense. It's anything but positive. You would think that progression from severe dysplasia to cervical cancer involving only the cervix would be a minor change, say from conization to removal of the entire cervix. But it isn't. And here's why. Remember the anatomy lesson on your cervix from video 342? Your cervix is actually part of your uterus. It's not easy to determine where one ends and the other begins. And it's very difficult and very uncommon to remove just the cervix and not the uterus. If I turn it this way, you see more what I mean, because I haven't got it all marked up for you. It's very hard to see where one ends and where the other begins right in this area, isn't it? With a partial hysterectomy, we remove just the uterus and not the cervix. But we don't typically do the opposite. So given that, you would then expect the treatment for stage 1 cervical cancer to be total hysterectomy, which means removal of the uterus and the cervix. But it's not. And if it's not that, you would expect it to be total hysterectomy with bilateral salpingo oophorectomy. That means removal of your uterus, cervix, fallopian tubes, and ovaries. But it's not that either. Nope. When you go from severe dysplasia to just stage 1 of cervical cancer, the treatment jumps all the way to radical hysterectomy. That's quite a great big leap. Radical hysterectomy involves removal of your uterus, your cervix, your fallopian tubes and ovaries, the ligamentous tissues surrounding all those organs, and your pelvic lymph nodes. It's radical. So the jump is huge from a simple destruction of cells around your transformation zone to removal of a huge mass of tissues and organs from your pelvis. And that's just for stage 1. Stage 1 cervical cancer is cancer confined only to your cervix. But look at how much is removed for it. It's definitely a big leap. So let's add that to our chart before proceeding. Moving on to stage 2 cervical cancer. If the treatment for stage 1 removes just about everything you have in your pelvis that is even remotely related to your cervix when the cancer itself is confined only to your cervix, then there's no surgery left for stage 2. So stage 2 cervical cancer involves radiation therapy and chemotherapy. It turns out that cervical cancer responds better to radiation therapy than to any other kind of therapy. So radiation is the cornerstone of therapy for cervical cancer. Sometimes a radical hysterectomy is performed first, and then radiation therapy and chemotherapy follow for stage 2. Other times, the radical hysterectomy is skipped and you just get radiation therapy and chemotherapy. Every case is different. But the key is to understand the critical role that radiation therapy plays in this particular type of cancer. I've told you before that cancers have personalities, and treatment is largely dependent on the personality of the cancer. But think about it. Here we are, just at stage 2, and the treatments have already spanned the gamut. For a lot of cancers, this does not happen until stage 4. So this is yet another example of the way in which cervical cancer treatment represents a big leap. So now we'll add the treatment for stage 2 cervical cancer to our chart. Okay, now for stage 3 cervical cancer. At this point, surgery is abandoned. In general, when it comes to cancer treatments that can involve surgery, once the surgery is no longer an option, things are really bad. And for cervical cancer, things are really bad at stage 3. Treatment of stage 3 involves radiation therapy and chemotherapy. The cancer has spread too much for surgery to be worthwhile. So here it is on our chart. And finally, we have stage 4 cervical cancer. This is when there's little chance of cure. And the only options are radiation therapy and chemotherapy. So here's our completed chart. I think it's really beneficial to know the progressive treatments for cervical precancer and cervical cancer because it shows you how much knowing the cause of a cancer can impact treatment. The reason there is such a huge discrepancy in the treatment options between cervical precancer and cervical cancer is that we know the cause, and knowing the cause changes everything. In essence, the more you know about the cause, The earlier you can diagnose the disease in the pre-cancerous state, and the less you need treatment. So, more cause equals less treatment. I think this is the positive aspect of a big leap. When it comes to cervical cancer, the desirable big leap is due to knowing its cause, not in its treatment. You can find this chart via the link in the description box, or you can go to menopausetailor.me where you'll find all of my charts. Alrighty, the summary for today is this. The treatment of cervical cancer and cervical precancer differ greatly. Precancer or dysplasia involves merely destroying or removing the transformation zone of your cervix. But cervical cancer treatment begins with radical hysterectomy for stage 1 and progresses to radiation therapy and chemotherapy for all other stages. Well, anytime you talk about treatment, the next topic becomes prognosis. In other words, what is the long-term outlook after treatment? How many women survive? So that's our topic for next week. How I love giving you this education. I'm not sure which I love more, making these videos or having consultations. If you like these videos, you will love a consultation. So schedule one at menopausetailor.me and I'll tailor everything specifically to you. Be sure to subscribe to this channel, sign up for my newsletter, and follow me on Facebook, Twitter, Pinterest, and Instagram. See you in a week, dearies.